Beep, 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 beep. Hello and welcome to the Court of the EDI Jester. Good afternoon, good evening, good morning, good night. You have the usual stuff. Join a cup of coffee, teacher, buy me a coffee, for God's sake, send me some money. Other than that, we are today heading at a rate of knots towards the marvellous Emerald Isle that is Ireland. How are we doing? There are Irish warrior teachers, you know who you are, you fabulous people, who I am sure will be more than pleased. And as one of the warrior teachers said yesterday, gender shoot has got a kick in, which it has. Gender shoot's had a kick in. So it has had a real kick in. And it's had a real kicking because there is a documentary, the link to which I will find and put in the doobies for you if I can find it, that went out yesterday that I think has changed the conversation in Ireland completely. And there was another wonderful comment, again, I think from a warrior teacher, saying the sound of people deleting their pronouns all across Dublin, right? Because this revealed the true lunacy and the true horror of this gender cult, which is what it is, a cult. I'm not calling it anything else anymore. So we have, on the back of that, this article from rte.ie, in which the headline reads, "Leading doctors report HSE to HIQA over transgender care. There's no such thing." The two most experienced clinicians involved in transgender healthcare in Ireland have made a formal complaint to the Health Information and Quality Authority. That's the HIQA, okay? About the Health Service Executive, which is the HSE, the treatment of children with gender identity issues. Prime Time, which is the television programme, has learned. Professor Donald O'Shea, apologies, this is an article by Paul Murphy from Prime Time. Paul Murphy, thank you, Paul. Professor O'Shea and Dr. Moran say that the gender-affirming model can damage children and is associated with a greater readiness to start on inappropriate medical treatment for patients presenting with gender identity issues. Dr. Moran told Prime Time that the complaint to HIQA cited a series of cases as examples of harm and risk caused to Irish children by these services. HSE flatly denies any allegations that it has put children at risk. And then it says, watch the full report on a special edition of Prime Time at 9:35 p.m. on RTE1 and the RTE Player, which is the documentary I have previously here aforetime mentioned, right? Ireland, along with other countries, has seen a surge in cases of gender-questioning adults and especially children in recent years. Gender question, they all need to get in the bin, don't they? A Children's Ombudsman survey last year of children aged 12 to 17 suggests that 1 in 25 identifies as either non-binary or as being a gender different to their biological sex. I mean, these medico-industrial predators must be chomping at the bit to get their hands on this young flesh, don't you think? You swine. How these children should be treated is at the core of the dispute, which is often heated. Yep, they shouldn't be treated at all. The gender-affirming model of care favoured by transgender activists and some clinicians internationally means accepting a patient's own view of their gender identity. So what it means is affirming a delusion and allowing the patient to diagnose themselves. Imagine if a patient came to you and said, I've done the diagnosis, doc, I've got it. I know I've got prostate cancer, right? So I need you to give me some chemo. And the doctor goes, yes, you're absolutely right. Here's the chemo. It's insane on every level. Every level. The problem is this, the WPATH model, which is, they're the real nutters, WPATH. The WPATH model is supported by the Irish government. That's the problem. Dr. Moran and Professor O'Shea argue that an exploratory model of care based on probing assessment should be used. They argue that this approach has a stronger role for psychiatry and is more comprehensive and safer. I disagree. The first role is an educational role. The first thing is an educational role. The first triage is education. I'm going to keep saying this until people start listening. You think you've got to what? Yeah. Go and do this. Go and talk to these people. Going to take you a couple of days. And then come back and tell me you think you've got that. Because that will then be confirmation if they come back after they've been given the facts and the reality. If they come back, that will be confirmation that they are delusional when you section them. And make them well. Help them to get better. So they give up this idea of trans altogether, which is just a delusion. a spokesman, because I can't pronounce the name, because I forget every time to ask my friends in Ireland who are warrior teachers. Sorry, I've done it again, all right? I'm sorry. From Trans Healthcare Action, somebody said that instead of causing harm, the gender-affirming model relieves distress for those needing healthcare. No, it doesn't. No, it doesn't. Right, it does not. It pampers to an internal delusion in which they will damage their own flesh, as they have done for millennia when they are members of cults. Think the Skopje, right? Think the Aztecs. Cults. Transgender youth and adolescents who receive gender-affirming care report better body image. They report better self-confidence and they report better overall mental health after receiving care than before. That's an extraordinary paragraph. Children, right, when given free rein and given what they want, report that they are immediately feeling better after that. 9 years. Post-surgery. That's when I reckon the real regret kicks in. It's a no on every level, right? According to the World Health Organization, gender-affirming care encompasses a range of social, psychological, behavioral and medical interventions designed to support and affirm an individual's gender identity. That's the World Health Organization. The entire globe has tipped to corruption. That's how I see it. Certainly in the West. It's tipped to corruption. Get out of the WHO. Get out of the UN. Drop the UNESCO goals. Drop the environmental shite. Come on. We've led before, we can do it again. It's time for Britain to stand on its own 2 feet. For children undergoing puberty, those interventions can include therapy and also medication in the form of puberty blockers, though restrictions on their prescription have recently been introduced. For children over the age of 16, cross-sex hormones may be prescribed. These ghouls, these absolute ghouls. People over the age of 18 may opt for gender-related surgery. Yep, shouldn't be able to do that either. Not on the NHS. You want to do it privately, and that private operation must cover your care for the rest of your life. You must have to pay an insurance premium for that. This should not be happening on the public dime. Others may socially transition and not embark on any medical treatment. That's code. Others may wear clothes that they think represent men or represent women, depending on whether they're deluded one way or t'other, and believe that they become something they have not. So in other words, adults may continue dress up. No, there is currently no functioning public service for children in Ireland with gender identity problems, and the adult service is a waiting list in excess of 3 years. Good, good. The longer the waiting list exists, the better, right, okay? The better. Get it gone. This is not complicated. Get it gone, right? Now, there's plenty more to the article, and there is the documentary. It's gobsmacking. You have to hear. Do you remember the loons? What was it Matt Walsh did? What was it called? What is a woman? Do you remember that? When you had that loons, that sort of tall, skinny bird with glasses. Do chickens cry? Do chickens have a gender identity? I think she's up on charges, isn't she, or something? There's something wrong with her. Something happened to her. Mad old bint, right? Do chickens cry? She had like sort of glazed eyes, and the other guy that was sat in the chair going, I feel uncomfortable about this conversation now because it's really getting close to reality and I don't do reality. It's just insane. So that was Matt Walsh's documentary, What is a Woman? Now we've got this one on RTE, which is a much more serious approach than Matt Walsh's. And by God, they cannot help but put their foot in it. It is utterly disgusting. That's the only way to describe it. Go watch. Let me know what you think in the comments. Let's keep battling. We're going to end this cult. Let's keep battling. See you later.